Welcome to Ridgecrest Talk. I'm Tonia Pyle, your host, with our guest, Debbie Taylor from the Senior Services of Indian Wells Valley. Thank you for joining me today.
Thank you for inviting us.
This Senior Service Center is one I'm so proud of here in Ridgecrest, or the Indian Wells Valley. And you are a case manager there, and you've been the one when I've popped in to pick up materials and different things to learn about the center. We've been trying to connect since last tax season, so here we are finally connecting up. But you're a case manager there, and I guess you wear several different hats.
I do.
Tell us about, but the case manager being your most prominent role, or?
One of the many hats that I wear. There's
okay.
no prominent over one or the other. I just try to juggle them all.
Whatever's needed at the time.
Yes.
Okay. Well, I'm interested in learning more about what you do as a case manager, or what your background is for that, or how does that?
Well, the case manager at Senior Services of IWV, we have several different types of forms that we can help the senior or the client with, such as power of attorneys, living wills. We get all of those and provide them for free to our seniors through the California Bar Association.
Oh, okay. That's kind of like paralegal work, actually.
No, we do not provide any legal services. We provide the forms.
Okay.
And then Yes, and then I assist them if they need, completing the form.
Okay.
But we cannot provide any legal advice or recommendations. But we provide the forms, and that's another thing of part of the responsibility of the case manager, is that if they senior needs help with Social Security forms or Medicare forms or annuity forms, any type of form that a senior individual would need assistance with help. Maybe they don't understand, the complexity of the form. Maybe they just want that extra support.
Well, when is it considered a case? I mean, is a case management?
When that individual needs more assistance than just coming in the office and needing some assistance. When it becomes a case is when usually the individual is usually living by themselves. They have some type of hardship understanding forms, mail, and an ongoing assistance is the best way to put it.
Okay.
And that could be from managing their finances, or helping to manage their finances, or coordinate other services that they may need, Social Security that they're not aware of. So it's a little bit longer of a process. And then once they get on their feet and are pretty well managed, that they can do that by themselves, that's when they're no longer a client.
Okay. Is that a paid service? Or?
We do not charge. As far as the case management, actually any of the programs that I am involved with, it's all free to the senior.
Wonderful.
Yes.
Wonderful.
They can make a donation because we are a private nonprofit, but we do not charge for any of the services except for the in-home care, which I'm not involved with.
I see. And so, now how did you get into this type of case management, and gerontologist, or?
Actually, due to some personal situations, I had to reinvent myself and to become a career woman, and I was always interested in the medical field. When I moved to Ridgecrest several years ago, I knew that I was interested in something medical and possibly something with the seniors. So when I found seniors, at that time it was called Homemaker Services.
Yes, I remember that.
Right, and I was able, I thought it was a great opportunity to get to know the, as you said, gerontology area of the senior, things that I could do one-on-one that I wouldn't be able to do in another type of field. And that's how it all came to be. I was getting my field work as a homemaker at that time. And
they trained here, or you did?
At Senior Services of IWV, yes.
Oh, okay.
As I said, back in those days, it was called Homemaker Services.
Right.
About 9 years ago, I believe, in I could be wrong on the number. They decided to change the name from Homemaker Service to Senior Services of IWV because the agency grew so much that we provide senior services instead of just homemaker services. So that's when they decided to change the name.
And homemaker services would be someone who is actually in the home and assisting with
Light housework,
personal care, and
transportation,
okay,
respite, pretty much cooking, pretty much everything an individual would need to help maintain their home or their self, except we do not do medicals. We're not going to do vitals. We're not going to do inoculations. We're not going to
administer medication.
Exactly.
Or anything of that
Exactly.
nature. You have a lot of valuable information at your center. Where does all of that come from?
I order it.
Oh, okay. Okay, because I think this is amazing. I mean, people should really check out the senior service. And before we go, we're getting ready to take a break. Tell people, some people may not know where you are. So.
We're located at 417 West Drummond Avenue, and that's here in Ridgecrest.
It's a lovely facility. It's really lovely. It's a home.
It's a home.
It's a home. And it feels like a home, very warm. So, okay, so you order that valuable material.
And we are the go-to satellite spot where other agencies and businesses that need to advertise for the senior, they can come in there and drop off brochures and things.
Their
too.
information.
And then I worked very hard with the Alzheimer's Association. I networked with them in order to bring a lot of material about all kinds of dementia. And
we have a local Alzheimer Association here in Ridgecrest.
It's not in Ridgecrest,
oh, okay.
but it is Kern County.
Oh, it's Kern County. I gotcha.
Yeah.
Okay, county agency. That's probably who you work with most, or do you work with the Ridgecrest Regional Hospital?
I work with all of the agencies that I am needing to, as a case manager, families,
assist
agencies, in order to give them the resources and assist
doctors.
them.
Do some of the doctors work with you directly? I'm sure.
Once in a while with the doctor, yes.
Okay.
Excuse me.
All right. Well, when we come back, I want to find out about some of the other programs. You have a lot going on there.
Yes.
So we'll come back and talk about your other programs at Indian Wells Valley Senior Services.
Okay.
Thank you. Welcome back to Ridgecrest Talk with our guest, Debbie Taylor from the Senior Services of the Indian Wells Valley. And I wanted to ask you about the various programs available through Senior Services. You folks have it going on there, so tell us about it.
One of the main programs is the in-home care program. That's where we call the ladies that go in the home, homemakers, go and assist the individual in their home from just about everything that they need except for medical care.
And I think you said this was a money income, a money resource. Is that right?
It's one of the ways that we get money into the agency because it's a private nonprofit.
Okay.
It's the ones that pay are we're the only ones in town that do a sliding scale based upon somebody's income. Let me say that first. But we also have a program for those who cannot afford the services. We call it our elderly home care that helps us through the county pay for people's services that cannot pay for it themselves. But that's one of our main programs that brings in the money. Pretty much all of the other programs, we do not charge for them.
So would insurance pay for it, or?
Some people have long-term care insurance.
Okay.
And then that's billed through the agency. They have to have documentation of what the client's receiving, and then that's sent on over to the insurance company. But it's usually out of pocket unless the individual has long-term care insurance.
And so then you, as a case manager, you're managing all of it?
I do not do that.
Okay.
I do not do anything for the in-home care program
Okay.
except fill in and step in and assist if that
If necessary.
coordinator's not in.
Oh, who's your coordinator for the in-home
Her name
care?
is Rhonda King.
Okay.
However, Barbara Geeson has been the she's been in the agency for many years. However, she's looking for her retirement years to come up, and so we've hired a new individual named Rhonda King, and she's the coordinator for the in-home care program.
Oh, I see. Okay.
One of the other programs that I assist in is I'm the facilitator for the caregiver support group. That's a support group for family members who are taking care of somebody that has some form of dementia, possibly Alzheimer's.
Is it only dementia, or could they have a physical disability?
It's mainly the group has geared towards some form of memory loss. That could be from stroke. You can have memory loss for all kinds of reasons.
Sure.
It's not only
it could be trauma. I mean,
that's right.
And any age actually.
Actually, yes. So I'm also the facilitator for our family caregiver support group. It meets the first Tuesday of every month at 11 o'clock at our office. We provide tools, education, support.
How many people participate, and do you have just one group that meets?
We have just one group that meets that one time a month. It's the first Tuesday of every month. Currently, right now, I believe I have about 15 in the group.
Very good. Very good.
So that's a great asset to the community also.
Yes.
Because of my work networking with the Alzheimer's Association, we've also developed a library that's specifically designed for the individual who has memory loss or their family members, to help educate them, help give them the tools that they need. So we've got a library where they can check out books, videos, DVDs, and then educate themselves and then bring it back just like a regular library. But we've got lots of free pamphlets and brochures and things there at the office that they're more than welcome to take.
Valuable.
One of the other programs that I help with is called Information and Assistance. That's where individuals can call and say, I don't know about Medicare, I don't know about Social Security.
Now, do you sign people up for that?
No.
No. Okay.
No, there is no sign up for it. They just call me, say I need information in Arizona, my mom lives there, what kind of resources do I need for my mom, or vice versa. The family member may live in Arizona and have a loved one that lives here in Ridgecrest. What resources are available? So I provide them, I do all the research, and then I'm either call them with that information that I've compiled and put together, or email it to them. It's just a good resource in order to get the information that they need. Another program that we have, our great Mr. Howard Ald helped design and was very instrumental in getting started, is the Healthy Homes minor maintenance program. That's where we have volunteers that go in the home for the senior that can't get on the ladder and change a light bulb, or they don't have the arm strength to unplug the pipes or something that get plugged up, or changing a gasket on the drippy faucet, just minor maintenance. So that's another.
Are those volunteers who do that?
Volunteers
Wonderful.
that do that.
And Howard Ald had coordinated that?
He had asked me, Debbie, would you manage it? He had designed it and was working on it for many years, and he approached the director about it, and they tossed it back and forth, and then finally he just says, Debbie, will you manage it? And I said, absolutely. So that's been going on for several years now.
We've got about 2 minutes before we go to our break, so what other programs would there be?
Let's see, that would be, we do the tax program for free for our senior community, and anybody that makes less than $53,000.
And we're going to get into that.
Okay.
But I love the idea that you have the library. Is it a lending library then?
It is.
Okay. So people check things out, and you hope they bring it back?
Sure.
And just like a regular, is it an official with a number, one of the national?
No, it's just
your own.
Your name, you checked out this book, and this is when you checked it out, and they returned it on this date. We try to keep things pretty simple there at the
What are some of the most frequent types of questions you have, or maybe a little problem area that is very common that you have to help guide people around? Or
it varies, but I will say that forms are a big one. Debbie, do you have the power of attorney for healthcare forms? Do you have the living trust forms? That's a common one. But I also have people who are visually impaired and say, Debbie, I can't find the phone number for, Stater Brothers, or, and so I call, I get the number for them so that they can make a call. It's just, every day's a new day.
Right.
Different questions, different challenges. It's just a new day just about every day.
Well, we're getting ready to take a break, and so when we come back, I want to hear a lot more about your upcoming tax program, because that's what's upon us. So we'll be right back after this break. Welcome back to Ridgecrest Talk with our guest, Debbie Taylor of the Senior Service Center of Indian Wells Valley. And I want to hear about the tax program. I understand you have people coming in today or tomorrow who will be training. Are they training volunteers, or who's coming to help you get set up and ready to go for tax season?
Actually, it was Monday. We had our
okay.
and we'll be having it again.
Oh, okay.
What it is that many years ago, when the agency first started, about 10 years after it had started up, they started the tax program through the IRS. It's called the VITA, which stands for Volunteer Income Tax Assistance / TCE, which is Tax Counseling for the Elderly.
Okay.
And then also in conjunction with AARP. So we've got two sponsors, which is wonderful, because with one, the IRS, the VITA TCE, we can help the senior that's got the pensions and then the annuities and the IRAs and all of those things. What's nice about having the AARP is if you make less than $53,000 a year, you can still get your taxes done there for free. A lot of people make a donation for the agency.
When
but
you
it
say
is
done there, you mean?
That would be at this, we've coordinated to have on Mondays at the Ridgecrest Senior Center at 125 Warner, and then Wednesdays and Saturdays at our office. They have to call and make an appointment first, because I have, through the IRS, we are required to fill out a particular form and ask all these detailed questions about what they're filing and this kind of thing.
So VITA is actually a tax.
It's a program through IRS, yes.
Oh, through the IRS. Okay, it's a tax program through the IRS. AARP is actually an insurance company that offers various services.
It is.
And sponsors different services.
A tax program.
But it's an insurance. Okay, so go ahead.
So
I just wanted to clarify a couple
we've
things.
done that for several years. The agency was established in 1972.
Yes.
But about 10 years after that, they started the tax program. So we've been doing that. In order for the volunteers to prepare the taxes, the tax returns, they have to be qualified. They have to be trained with so many hours.
Is it a certificate? Okay.
Yeah.
Good.
And they have to pass with, I believe it's 98%, 99, 97%.
It's a high standard.
Yes, in order to prepare the returns for the public.
Is it the same type of training, say someone who was training for H&R Block to do taxes for them?
I don't know.
Oh, okay.
I have not a clue.
That's fair. That's fair. You don't have to know all the...
And I am the local coordinator for those programs,
okay.
for the tax program. Mine is very minor compared to what the volunteers do. They are just wonderful
So this
people.
group that comes in, they give them that required training that brings them to the standard?
The group that comes in are the volunteers that are getting trained through the professionals, either through the IRS site or individual, and then through AARP. They send out a representative in order to have so many hours in order to do the AARP tax preparation. So they meet at the office. They are just the greatest volunteers anybody could ever ask for. patient, kind, and is very knowledgeable. Some of them
I'm
have been
sure.
doing
Yeah.
taxes for over 30 years.
Have to be able to
Some
work
were
with numbers.
tax preparers through the different agencies, such as you named it earlier. So I'm just very proud of them. They do a great service to the community.
But then the group that actually comes in to train them, who are they?
It's not a group, it's an individual.
Oh, it's an individual.
And he is specially trained. Every year he's certified through IRS in order to do this training for the individuals.
Well, where's he from?
Ridgecrest.
Oh, he's from Ridgecrest. Okay,
Right.
that's what I would have guessed, but just to clarify.
Yeah.
Okay, so how many hours do they require?
I don't know.
Yeah.
I don't know
Okay.
that.
So about how many volunteers?
Right now I have 9 volunteers, and we are in desperate need of more.
How many people usually go through that program? You're busy.
We're very
once
busy.
it kicks in.
We are very busy. In fact, I'm already getting appointments now because they've gotten very savvy. They know that their annuity and all their information is going to be in about February, March. So they're already planning ahead and making their appointments now. We're pretty good at getting a lot of people. We don't have to turn very many away, but yes, we've got 9 volunteers. We're looking for more. If anybody is computer savvy, tax knowledgeable, we could really use some more tax volunteers to just call the office and get a hold of me, and I can help them in that area.
Boy, that's a wonderful service to provide for the seniors here in, what requirements are there to be, what's a senior these days? It used to be 55, didn't it?
It did through certain, but ours is usually 60 years of age and older.
Okay, 60 and older.
That's for, senior services of IWV. Through the tax program, I know what I was, we also have an equipment loan program. Rose Vargas started many years ago. There's no age for that either, where we loan out hospital beds and walkers and wheelchairs and things like that. So the tax program and the equipment loan program, there's no age limit on that.
Okay.
We had the cutest little red wheelchair that somebody came and borrowed a few years ago for a little 3-year-old that had an accident at the school. So the tax program and the equipment loan program is any age.
Really? Oh, I didn't know your tax program was any age.
Yes.
Oh, that's
as long as they make less
amazing.
than $53,000, we squeeze them into the AARP program.
I see.
The older individuals who's got the annuities and the more complex returns, that would be through the IRS program. So we're very lucky. We can, get a lot of people in the community. It's over 300, I believe, that we serve through the tax program. So
That is substantial.
well, it's a help, and some of the seniors just do not know what they would do without the tax program.
I can imagine.
Because nowadays you're paying quite a pretty penny.
It says probably a certain percentage.
So they're very grateful for the volunteers that take that 3 months out of their year to help.
And are there other areas you could use volunteers?
Absolutely.
Before we go?
We need the Healthy Homes
Okay.
program. We could use some, wonderful individuals to just go in the seniors' home and help them change a light bulb or something very minor.
Well, what number do they call? Oh, sorry.
And also local volunteers.
Yeah.
Or local drivers that would just take somebody to the hospital.
Doctor appointment.
Or a doctor's appointment.
Because a lot of people now need to go to Lancaster. So
we don't expect them to go out of town.
Okay.
Just local
Well,
would be
in our
great.
last few seconds here, what's the number to call if they would like to volunteer?
760, of course, 375-2352.
And one more time?
760-375-2352.
Thank you so much, Debbie Taylor, for
Thank
joining
you for
me.
having us.